Over 4,000 Zimbabwean doctors and nurses left the country in 2021. Zimbabwean health workers have left the country in droves over the past year. A senior health official at the Health Services Board revealed on Sunday. More than 4,000 health workers have left since 2021. HSB chairperson Dr Paulinus Sikosana told Reuters. Now, this includes more than 1,700 registered nurses who resigned last year and more than 900 who left this year. Health workers went on strike in June, demanding to be paid in US dollars as inflation further weakened the local currency. Doctors and nurses in Zimbabwe have found work mainly in Britain, leaving the country's health sector in dire straits and local hospitals understaffed. Well, to help us with a little bit of understanding of what's going on, we're now joined by Dr Brian Sedze, who's the director of Free Enterprise Initiative in Zimbabwe. Thank you so much indeed for joining us. Welcome to the program.
Thank you very much, Peter. Thank you for having me.
It's almost hard to believe that so many health professionals could be leaving the country in a short space of time. What is it telling us about the state of the profession in Zimbabwe?
Peter, I think I need to run you through the economic history of Zimbabwe. Just a bit. It won't take you a long time. Since 1980, Zimbabwe has not been able to take care of its health service provision. When we got our independence in 1980, many medical health facilities were for the minority. And when we came into 1980, a lot of us Black people came into the mainstream health services that were reserved for the minority. But that's not a big issue, if I may put it that way. The major issue is that from 1980, Zimbabwe has been surviving, building infrastructure, having equipment, and having health service provision, mainly as a donor recipient from the European Union, from the United Kingdom, and the United States of America. That gap was already existing from 1980. So we come back to 2002. That funding dried up. Even if Zimbabwe had started to say we must have health for all by 2002, which resulted in people building a lot of hospitals, clinics, and so forth. All that was donor funded. Zimbabwe never had money to fund its doctors, its nurses, infrastructure, equipment, medication. It was all donor funded. So when 2002 came, sanctions came into place. Some people prefer to call it restrictive measures. Some call it all sorts of things in Zimbabwe, because in Zimbabwe there is no real thing that we speak about without political division. Now that money dried up, donor funding went away, equipment suppliers just went away. Now it gave Zimbabwe a bit of a challenge because of governance issues, where funds were not being driven to the right sectors and money was not being channeled to the health services sector. It was a new thing that came to Zimbabwe, okay? Peter, I will tell you one thing. Zimbabwe has got a lot of money, it has got a lot of resources, but the challenge that we have right now is the doctors and the nurses and the health services facilities are all bundled together in what we call a public service commission. Now, you can't increase salaries of doctors without increasing salaries of teachers. You can't do that without increasing salaries of the army. You can't increase the salaries without increasing. So it is a mesh. It is a mess. It is a mesh. Now, why are doctors leaving? is that historical perspective. And number two, it is because Zimbabwe has never done a job grading in its medical services. So as it is at the moment, a medical practitioner and a gardener at a hospital are almost on the same salary range. A medical practitioner gets 350.
Let's just get that straight. You're saying a gardener is getting almost the same as a doctor?
That is very correct. I will just give you a typical example. A gardener at a hospital gets 250,000 Zimbabwe dollars. A doctor gets 350 United States dollars. They get the same amount of United States dollars. While a doctor be staying at a facility where his education of 7 years at a medical school is regarded at the same level with a gardener at the same hospital. It is regarded at the same level with a teacher who went to school for 3 years. It is regarded at the same level with an army person who went to school for 6 months and a police officer who went to school for 6 months. So
there's
things were equal.
So there's no real value of work. Everybody in a typical old socialist ideal contributes equally to society and must be paid the same.
That is very correct, Peter. A person must be able to obtain value for the labor and the intellect and the education and the time he spent to education. It is not so in Zimbabwe because you basically the same with an army guy, with a police officer, with a teacher. Not that those professions are not important, but we have got a person who has gone to high school and who has gone to university for 7 years, earning the same amount of money with a gardener who has only gone down to Form 4. It is almost the same. The difference, if I may put it into correct perspective, it is as little as 60 United States dollars.
All right, so let's just get this straight. A doctor earns what, 350 US dollars? Is that per month?
Yes, it is per month.
That's about 6,000 Rand.
That is correct.
For a medical doctor.
That is correct.
Which means the nurses are getting paid even less. And this is why they're leaving in their droves. Because here they'll be earning 10 times, 20 times more.
Look, every medical person in Zimbabwe wants to leave. Almost everyone wants to leave. It's just the government has changed the rules of engagement. They have changed the rules where they are making it difficult for people to leave. But everyone wants to leave this country. In fact, if the rules were being applied fairly and equally, we will not have any doctor or any nurse left in Zimbabwe in the next 3 weeks.
Have the authorities given any indication that they're going to relook this? Because clearly this is unsustainable.
The challenges we have in Zimbabwe is of a macroeconomic nature, where the resources to the critical facility like healthcare have not been directed there. But that is not the only challenge. The challenge is that there's never been a proper job grading system which ensures that a person is paid for competence, is paid for education, is paid for skill, is paid for years of service, is paid for the amount of professional development courses he has gone through, is not paid for the amount of effort he has put into the system. So you are part of a bunch where your effort is not recognized. That has to change, Peter, because if you're a professional, you can't be part of a bunch without you being remunerated for effort, remunerated for output, which is a very big issue. But in its all essence, the basic salary of any medical person is just 30 times below any of our regional counterparts and possibly 80 times below international standards. A doctor is part of what we call globalization of labor. Globalization of labor, where a doctor in New Zealand, a doctor in Malaysia, a doctor in Zimbabwe, a doctor in Egypt is the same. And who wants to say in a country where you're paid $350 United States for being a medical practitioner after 7 years of education, just at the same with a person in the other countries that I have stated?
Help people understand, because, you know, yes, there are sanctions, but you said since 1980, a lot of investment has been donor funded. But this is a country that is top 5 platinum producers in the world, was one of the top producers of tobacco in the world, and has got a whole array of minerals export. I think top 20 diamond exporter. There were alluvial diamonds in Marange in the billions. How is it that no investment or very little investment was ever put into healthcare?
In my view, Peter, the reason why there's not been an investment in healthcare is because of what I would call negligence on the part of our government in what really matters to its society and to its people. We pretty understand there's a lot of revenue that comes into the country. It is not going to the correct funnel of budget. It is not going to the correct funnel of investment in societal needs. Healthcare at the moment is not a priority. I'm sure it has been said hundreds and hundreds of times that we don't have cancer machines, we don't have MRI machines, and we don't have a lot of things that we people require as medical doctors. One of the things that makes these doctors even want to move out of the country is that they don't have the basic PPE equipment. They have to be protected against diseases. They are doctors, but they don't have basic protective equipment. They are staring at patients. They don't have medication. Every patient that goes to a public hospital end up having to fund for his medication, end up having to fund for it using his own private funds by going to the pharmacy himself and having to pay for basic things like a painkiller. It is actually a thing that is caused by negligence. And that negligence is because we're not putting resources where the people are affected. It's because of that donor syndrome. From 1980 to 2002, we had been used to non-governmental organizations, non-state actors, international governments in malaria, the Bill and the Melinda Gates Foundation, and so forth, having to put money into our health system to fund its own growth, equipment, medication. We couldn't manage after 2002, and it's unfortunate.
Dr. Sedze, we're going to have to leave it there, unfortunately, but let's hope that some solution is found, because ultimately, sadly, it's the ordinary citizens that will suffer with this exodus and this lack of investment in the healthcare facilities. Thank you so much for your time.
Thank you very much, Peter.
All right, that's a shocking story there. One doesn't even know how to unpack this. Just to give you an idea, we're told there that doctors, 7 years studies plus internship, all of that, earn $350 a month. That is the equivalent of about 6,000 Rand. And that's what you'll earn if you're a petrol attendant in South Africa.